Today we'll be talking about the two main disorders of polyamine synthesis. We'll also talk about what polyamines are, as well as how they're made. So polyamines, as the name implies, consist of poly or multiple amine or nitrogen-containing groups. So these are molecules that contain multiple nitrogen groups. They're made in humans in a four-step pathway, which we're looking at here, that starts with ornithine and ends with spermine. So the first step and rate-limiting step of this pathway is for ornithine decarboxylase to take ornithine to putrescine. The way it does that is by removing this carboxylic acid group. Next, putrescine is converted to spermidine by the enzyme spermidine synthase, and it also uses this molecule called decarboxylated S-adenosylmethionine, or DC-SAM. And the last step of this pathway is for spermidine to be converted into spermine by the enzyme spermine synthase, or SMS. Now, individuals with loss of function variants in SMS have Snyder-Robinson syndrome, which we'll talk about. The other disorder that's present in this pathway is called ODC superactivity, where you have too much activity of the enzyme ODC, resulting in elevated levels of putrescine. Okay. So first up is ornithine decarboxylase superactivity syndrome, also known as Bachmann-Bupe. So this is a dominant disorder due to gain-of-function variants in ornithine decarboxylase. Patients have developmental delays, alopecia, macrocephaly, facial dysmorphisms, as well as white matter abnormalities on neuroimaging. The labs will show elevated levels of putrescine, and the molecule difluoromethyl-ornithine, or DFMO, inhibits ODC and is in fact very similar to ornithine itself, and it's being explored as a potential treatment on a compassionate use basis for this condition. Okay. The reason why putrescine levels are important is because putrescine can be converted into GABA, and GABA is a neurotransmitter. So anytime you have a neurotransmitter imbalance, that can lead to developmental delays, intellectual disability, and seizures, which are all features that we can see in patients with ODC superactivity. The next disorder in this pathway is called Snyder-Robinson syndrome, or SRS. This is a X-linked recessive disorder that's due to variants in spermine synthase. So you can remember that just by looking at the letters of Snyder and seeing that there's some overlap with the letters spelling out spermine. Individuals are usually boys, because this is an X-linked disorder, who have developmental delays and intellectual disability, as well as seizures, hypotonia, and facial dysmorphisms. Patients can also have, and this is very characteristic for this disorder, they can have osteoporosis. So basically will present as non-traumatic fractures. So the way you want to remember this is Robinson syndrome, to remember the low bone density that's associated with this condition. Patients have elevated spermidine as well as an elevated spermidine to spermine ratio in their blood. Looking at the pathway should help you understand why this is the case. And management for this condition is primarily supportive. If you found this video useful, please like, subscribe, and share. You can also subscribe to my weekly newsletter that has board-style questions for genetics exams. You can also buy me a coffee to show your support for this channel and the newsletter. Thank you.